Did you know that oxygen has a more energized form, meaning it's more reactive, it's stronger, creates more effects inside the body, far beyond just helping us breathe and improve oxygenation? Did you know this form of oxygen can also help improve cellular health, fight off viruses, and even help with chronic pain? Today, I'm talking to you about ozone therapy. So, ozone therapy is using ozone, which is a medical grade gas created from medical grade oxygen using specialized devices. Now, I know this might sound like a very strange concept, but this is a therapy I use a ton in practice, and a lot of my patients swear by it. So, for today, I wanted to help you guys understand what this unique therapy is. It's been around since the early 1900s, yet I bet a lot of you have never even heard of it. And for a lot of people, it's extremely helpful. So today I want to help you understand what it is, what it's doing at a cellular level, the specific conditions that it can be used to treat, and how we're administering it and some cautions around it. So hopefully this is a short and sweet episode where you can get a general grasp of what this therapy is, why it's being used in offices such as my own, and really help understand if this is a good option for you and what you're currently going through health-wise. But first, let me briefly introduce myself. My name is Dr. Robin Lewis. I'm a naturopathic physician practicing in Vancouver, British Columbia, Canada, and let's get into it. So the first and most obvious question I need to answer for you guys is, what is ozone? What does that mean? And so ozone is referring to O3, oxygen 3. The normal oxygen that we breathe is something called O2, oxygen 2, meaning it's two oxygen molecules together. And so in the case of ozone, it's 3. So you can only really generate ozone when a huge energetic force is applied to oxygen. So something like lightning or ultraviolet radiation. And so this natural occurring process will generate O3, which is technically an unstable molecule. And that's exactly the purpose behind it. So this is technically a naturally occurring thing, which is why you may have heard of it, aka our ozone layer, which is a layer surrounding our globe that will protect us from ultraviolet light. And so the same ozone is being talked about here. The ozone that is in the atmosphere is the ozone that we're trying to generate and concentrate and use for medical purposes, which again, I know is a very strange concept, but it has been used for a very long time. And so for a lot of people, it's also very important to note that when you do these therapies and you use these ozone generators to create O3, you're still getting a lot of oxygen. It only does that in a very inefficient way. So what that means is the final product, when I use my ozone generator and I have the gas that I'm using as a therapy, it is still mostly just oxygen. Only 1 to 3% of that process will generate true ozone. So I mention this because when you're thinking about ozone therapies, I'm going to talk about all the benefits of ozone itself, O3. But just note that a large part of that product is still oxygen. So there are going to be other benefits to these therapies that just apply to the fact that you're improving oxygenation inside the body, which is related to a lot of disease and ailment in of itself. So I'm not going to spend time today talking about why improving oxygen inside the body would be of help, because that's an entirely different topic. I'm going to focus on the unique aspects of ozone, but do know that you're kind of getting both benefits in one therapy, because there will still be a vast majority of just pure oxygen, O2. But then we're also seeing a little bit of ozone, and that has its own unique benefit profile. So circling back to what ozone is, it's a colorless gas that has a distinct pungent smell to it. If you have been caught up in a lightning storm, you will understand what that smells like, because there is usually a distinct odor in the environment after a lightning storm, and that's because it's generating ozone. Ozone's technically heavier than oxygen and it dissolves more easily in water, but again, that's because it's more reactive. So that third oxygen is going to try and detach itself and react with something else. So it'll often find things like different lipids, aka fats and proteins, distinctly in an inflamed and damaged tissue to react with. And then once it reacts with those tissues, it's going to form peroxides. These peroxides easily cross the cell membrane where it can have an inside the cell effect, an intracellular effect. One of the things that it has been shown to do is it helps regulate inflammation, it stimulates our natural antioxidant production, and it's going to help with energy production by converting NADH to NAD+. And so if any of you guys have been in the realm of longevity, we know how important NAD is in the cycle of energy production inside our mitochondria. So that's how it's helping with energy production, is it's helping reform NAD+, which can go through these cycles and generate more energy inside the cell. So that's just one way that ozone is having this reaction, which sounds like it should be a bad reaction, but it's stimulating an internal process in response to this very reactive, unstable oxygen that is actually of benefit. So in simple terms, it's essentially stimulating the body to produce more antioxidants and to kick some of these cellular processes into high gear. It's kind of like what you see with exercise. Exercise technically creates damage inside your muscles, but it's the adaptive response that your body has after the exercise that is of benefit. And so ozone is creating oxidative stress inside the body. It is a stressor, but it's the adaptive response to the stressor that is of benefit. So very similar concept to exercise. Technically, if you were to look at just exercise in the moment, it's only creating damage. It's tearing muscles, it's doing all these things. But we all know exercise in the long run is extremely good for us, especially if not overdone. So the concepts are very similar here. Another extremely unique and helpful function of ozone is its ability to help kill off microbes. So that could be bacteria, viruses, parasites, or fungi like candida and mold. It's extremely antimicrobial. And so essentially that same oxidative stress will react with the proteins and the lipids in the cell membrane of the bacteria or the viral envelopes and essentially cause so much stress on these organisms because they're a little bit more vulnerable, less robust than our own cells, and it'll cause them to burst and die and lose function. And so this is why you see it used a lot. In fact, historically, it was used almost primarily for infection control, treating wounds, stopping the infection from spreading. But then you can also use it in the context of chronic infections like Lyme disease. And so this is a big area that ozone is being used in practices like my own. We see a very unique population of people who don't have a lot of treatment options available to them. And ozone is extremely helpful for, yes, improving mitochondrial function and cellular health, which when we get into the benefits and the conditions that we use ozone for, a lot of those functions are why it's helpful for some conditions, but then a lot of it is very antimicrobial, which is why it's helpful for some other conditions. So those are just two of the key features of ozone, which make it so applicable to so many different ailments. So with that in mind, let's get into some of the specific diseases or ailments that ozone has been shown to be helpful for. They've never studied all of the potential benefits of ozone, of course, but these are some of the things that do have some research on it and things that I certainly see helping my patients in real time in practice. So the first and most obvious application of ozone is in the context of chronic infections. So I'll just point out one specific type of use, but of course this can be used in a lot of different contexts. There's a lot of different types of chronic infections. But for example, because they know that the ozone is really toxic to the viral envelope and can have a really good antiviral effect, when COVID, the pandemic hit, they did do some small studies in hospitalized COVID patients, and then they treated one of the treatment groups with ozone. They did a blood ozone treatment, and then there was the group of people that just received standard care. There were better outcomes in the ozone treated patients, and that makes a lot of sense if you understand how ozone works. And the other application where it's been extremely helpful is in the context of long COVID. So some people don't make a full recovery. There's a lot of different reasons that can play into that. And of course, if you want to look up long COVID, I did a video on that one as well. But there's more than just the suspicion that the infection's hanging around. Sometimes the long COVID, sometimes the COVID will reactivate chronic infections that were already there, like Epstein-Barr virus. And we also know that it can just be a product of a lot of inflammation, immune dysfunction, cellular unwellness, for lack of better words. And so I think that's why ozone's super duper helpful, is because it's not just antiviral. It's also helping your immune system, cellular health, mitochondrial health, all of which are other aspects of long COVID. And so this is one clear example that I think a lot of us can relate to, but that does have much broader impacts, and you can use it for other chronic infections like Epstein-Barr, like Lyme disease, like mold illness, because a lot of the concepts are very similar. And again, ozone isn't just antiviral, it's antimicrobial, meaning it could be applied for viruses, bacteria, parasites, and fungi. Another extremely common clinical use of ozone is for chronic pain. So that's in the form of injecting ozone into joints and tendons and things like that directly. This is something called prolozone. It's one form of application when it comes to ozone, which I will get to later. But when you go into these areas of concern, say you have knee pain, knee osteoarthritis or something like that, you can inject directly into that joint or whatever tissue you're trying to help heal. And again, it's going to improve the oxygenation because there's a lot of real O2, just plain oxygen, within that gas. So a lot of people's chronic pain is due to poor blood flow, poor oxygenation. It's also going to help control inflammation. So inflammation, when controlled, totally good for the body. When uncontrolled, leads to a lot of damage and pain and nerve sensitivity. And so it's helping improve the nutrition and the oxygen of the area and remove some of the damaging inflammation and just provide better function back to those tissues so they can properly heal. And so this is a huge area of use for ozone that I do personally. It's one of the things you get taught in the courses. There's a lot of benefit when it comes to pain conditions, improving tissue recovery and things like that. Another really interesting thing that I found, and this was mostly because I have a bit of a vested interest. I was looking at, can it be useful for lung conditions like COPD, which are extremely hard conditions to manage, and I have some family members with this. So I was particularly interested in that. And yeah, there weren't a ton of studies, but there were a few using rectal insufflation. So again, you can administer ozone a bunch of different ways, but they administered it that way, and they did find improved outcomes, which makes sense. If your lungs are scarred and damaged, and there's a lot of things that go into COPD, but you're inevitably not getting good oxygen distribution inside the body. It's a lung condition. And so, not surprising, it helps improve some outcomes when it comes to lung diseases like COPD, because at least you can administer some oxygen in another form. You can help clean up a lot of the inflammation because there's a lot of scarring and stuff that is associated with COPD. So it can help a lot of different aspects related to it. So not surprising, there are a few small studies that show positive outcomes for those lung-like conditions. There's also quite a bit of research to support the use of ozone for cardiovascular disease, which is really interesting because typically they talk about oxidative stress being, not great for the health of your blood vessels and things like that. But again, this is like a very controlled, low dose of it to stimulate a natural response inside the body. And so again, kind of like exercise, if it's not overdone, it's actually going to have a reactive benefit inside the body. And so yes, again, part of that has to do with just simple oxygen delivery, but ozone itself has also been shown to stimulate more nitric oxide production inside the blood vessels, which will cause them to dilate and reduce blood pressure. So blood pressure is one potential benefit of ozone, because a lot of the times when our blood vessels get beat up and damaged and dysfunctional, they stop producing as much nitric oxide, which means they will stay more constricted, drive blood pressure up, reduce blood flow to tissues that need that oxygen and whatever the blood's trying to deliver. And so there are some very unique benefits of ozone for cardiovascular disease. It's been studied in conditions like heart failure and actually been shown to improve ejection fraction. So the function and the contractions of the heart are working better. It's better able to deliver oxygen to tissues. And so that's just one example of a cardiovascular disease that has been shown benefit, but it makes sense in the broader context because it's also really helpful for your mitochondria. And your heart is one of the most dense in mitochondria because it requires a lot of energy. It's a lot of effort to pump that much blood all the time throughout the body. So it's a very energy demanding organ. So again, there's a lot of different angles that you could argue ozone for when it comes to cardiovascular disease as a whole. A few other areas that had some studies on it were the use of it in dental work and digestive disorders. So in this context, they were studying things like ozonated water and oils. And they found it could be helpful for things like gastritis, which is inflammation of your stomach, esophagitis, inflammation and scarring of your throat and your esophagus, H. pylori, common gut infection, a viral gut infection that leads to a lot of stomach ulcers and gastritis, various different microbiome issues, because again, it's very antimicrobial. So a lot of these digestive disorders, it was shown to be helpful for. And then in the context of dental work, because again, it's antimicrobial, it can be useful for things like dental abscess, gingivitis, like inflammation and damage of the gums, and a lot of different dental oral problems. And so again, this is just another application for ozone. And very briefly here, I'm going to get into the different ways it's administered so you can understand how that's working. But these are just the things that have been studied. Ozone is not particularly well studied. This is not a well-funded therapy. And so don't get me wrong, there's not enormous double-blind placebo trials with 20 of thousands of people in them. You do kind of have to pick through a lot of information to find these small studies. But overall, they're very safe, effective, and generally speaking, if it's not creating benefit, it's not creating harm. So it's definitely a therapy that I trust. I use a lot of, I've never seen a negative outcome from, but there are some safety concerns which we're going to go over just in a brief moment here. So you can administer ozone a lot of different ways, but you don't want to inhale ozone. So I'm just going to mention this now, and I'm going to mention it when I talk about the safety concerns again. Inhaling ozone is not good. Your lungs do not like ozone. And so that is the one place where you'll see negative research and cautions and red tape around it. People are like, ozone's so bad for you. Yes, if you inhale a bunch of ozone, it's not good for you. So there are certain ways you can go about it to remove those safety concerns, because that's really one of the only safety concerns. So you just don't give it through inhaled versions. So one of the most popular ways it's administered is through the blood. So this is often referred to as major autohemotherapy. Sometimes you'll see different terms like 10-pass ozone being used, but this is essentially referring to mixing ozone with blood, so your blood. I'll do a blood draw from a patient, mix their own blood with the ozone. Sometimes they'll throw saline in there as well, and then reinfuse it back into the patient. So you're mixing the ozone and the blood together and then giving it back to them. And then that way it can have a whole body effect. It's getting into the bloodstream and distributed all throughout the body. So major autohemotherapy is one of the most common forms of it. There's also things like minor autohemotherapy, which is just doing lower doses and lower volumes of the exact same process. Another very popular way of administering it is rectally. So you take a bag, a medical grade bag, you put a bunch of ozone into it, and yes, it goes right up the bum. And I know that's a strange concept for a lot of people, but you actually absorb a lot through your colon and your digestive tract. And so it's trying to get into the body through that route rather than going in through the blood. There's a couple reasons why you might choose rectal ozone. It's a little easier if you have your own ozone machine. You can do that every day. You can't necessarily draw your blood every day. You know, if you want to have more of a localized effect, it's not quite as strong as blood ozone. I believe they say it's like 75% absorbed, and you can't administer as much because there's only so much room there. But again, just another option if blood ozone is not a good fit for you for whatever reason. The third way you see it used is through injections. And so again, you can inject lower doses of ozone into tendons, joints, ligaments, and that's often used for pain, healing damaged tendons, ligaments, whatever structural damage you're trying to repair. You can throw prolozone, which is just a different term for injectable ozone, where you're going into the damaged tissue and you're just injecting a small amount of that gas. You can also see it being administered in the form of insufflation. So kind of similar to the rectal insufflation, where you put gas up there, hold it, and try and have it absorb into the body. You can also do little boluses into the vagina for vaginal infections. So it can be really helpful for very chronic, stubborn yeast infections and things like that that aren't responding to typical therapies. You can do it into the sinuses. It needs to be done in a very specific way so you don't inhale too much of that gas. So that one is very much a don't do at home. You can do it into the ears for chronic ear infections. And so these are more direct applications. You have an infection in this area, we'll pump a bunch of gas into that area. And similar concept, sometimes they'll infuse oils and water with ozone to have a topical application. So say you have a wound, you can't just put gas on it, it'll just dissolve into the air. So sometimes they'll infuse things like oils with the ozone so that it can be applied topically. And so those are some of the many forms of administering ozone. And then there's different concentrations of ozone that can be put into these different forms of therapy. And so more or less, those are the main ways that therapists are giving ozone. Okay, we're getting there, almost there. So a couple safety concerns around ozone. The first thing being what I've already mentioned is that you do not want to inhale ozone. And so it's an irritant to the lungs. And part of the problem with that form of administration is that your lungs just don't have the antioxidant capacity to properly respond. So ozone creates a little bit of oxidative stress that is supposed to stimulate an antioxidant response, and then that's the benefit. But if there isn't enough antioxidants to respond, then you're just going to be stressed. Your body will just be stressed. You won't get that adaptive response. This is why you need to work with a trained professional who knows how to dose this properly. Ozone, like most therapies, is not a more is more sort of situation. You do not want to exceed the capacity of your body to respond to it. Another big thing is you need to look out for a G6P deficiency. So you need to get a G6P test, a blood test done. So that will also screen for people who are going to respond poorly to ozone. So if you have one of these deficiencies, which is an easy blood test to get done, then it's going to cause a lot of red cell destruction if you administer the ozone. So everyone who's going to do ozone should get that one test. And if you aren't positive for that, then you are in the clear to get ozone in the various different forms except lung administration. I wouldn't do it in pregnancy. I think there's a lot of reasons we don't risk anything in pregnancy. So that would be another area where I very clearly wouldn't use it. And often it's discouraged in really severe mast cell activation and histamine intolerances. And so that would be another area I would not want to do it. So that kind of concludes it for today. Hopefully you get a better idea of what ozone is, what it can be helpful for, who's not a good candidate for it. And again, you need to work with a trained healthcare professional. It does require specialized training. So not every doctor, not every naturopath is going to know what this is or be capable of administering it. So if you do want to do this therapy, you do kind of have to vet out who is trained properly to do it, who is certified to administer it. But other than that, it's a really cool therapy and I see a lot of benefit in my patients. So thank you guys again for listening, and I hope it was a good episode. Comment all of the questions, or if you have personal experiences with it, those are always great comments as well. And I look forward to seeing you guys again.